Three ugly problems that can happen when a person is dying. Number one, some people end up with something called a GI bleed or a bleed in their digestive tract. This might look like a person vomiting up something that looks like coffee ground. It usually looks like a brownish color. Sometimes it actually smells like poop. You'll probably smell that iron-like smell. It may also come out in the stool, and it makes the stool look tarry and black. Sometimes it is bright red depending on where that bleed is. I once had a hospice patient with a peg tube or a feeding tube in their stomach, and this coffee ground appearance just straight out of their tube and around their tube. If this happens, call hospice right away. There are medications that we can try to help, number one, decrease any sort of distress for that patient, and number two, help to decrease the risk of ongoing bleeding within the digestive tract. Number two, significant wounds. Oftentimes I see some of the most significant wounds on the backside, around the butt, around the sacrum, and around the back of the hips. When someone is dying and they're not moving around as much and blood flow is decreasing, especially to the skin, and the body is naturally starting to break down. Sometimes wounds are inevitable no matter what we try. Sometimes these wounds can be so bad and so deep all the way down to the bone, and they have an extreme odor to them. And so if you see any wound at any time, let your hospice nurse know so they can try to start treatment right away to decrease the risk of making this worse. Number three is pain. As much as people believe that pain is a natural part of the dying process, it's not. Pain comes from that person's disease process. Hospice is very well equipped for managing pain. Make sure that you are communicating and advocating to your hospice team. Reach out to the medical director if needs be. And do not let your loved one's pain go unmanaged. Learn more about end-of-life care and support at our free training at deathcarecoach.com. My name is Katie Duncan. I'm a nurse practitioner and an end-of-life coach. Follow me for more end-of-life education.